Cataract. Cataract is defined as the opacity or cloudiness of the crystal lens. This could be in the form of developmental or acquired. That is to say, when you see a patient who has cataract, if you look at the eyes of the patient, you will see the lens is clouded. Look at your screen, you will see it. That is a pure example of cataract. So cataract can be or can result from developmental issue during when the child is inside the uterus, or it can as well be acquired during the lifelong processes, such as old age, from traumas. Cataract is the commonest cause of blindness and tends to occur more among old people. But this does not mean that it cannot occur in other age grades. It has its highest incidence among elderly people from the age of 50 and 70 years above. This disease condition affects the fiber and the nucleus of the lens, making it very hard or making it to be hardened, which now makes the lens which now leads the lens to lose its ability to converge. You know that the lens does what is called accommodation, so that light rays from far distance can be focused effectively well on the retina. The same way, light ray from shorter distance can still be focused on the retina, enabling formation of image. Cataracts can be defined according to types, location, and degree. Types of cataracts. 1. Congenital cataracts. Infantile or juvenile cataracts. Senile cataracts. Traumatic cataracts. Toxic cataracts. And cataracts that resulted from systemic diseases. From the outline types, you will agree with me that congenital cataracts resulted from the womb. It resulted from the womb. Then the other type, which is senile cataract, is as a result of old age. When we look at the congenital cataracts, it can result from the child having issues with the genes. That is, it can be in form of autosomal or recessive gene, or it can also be sex-linked. Okay. Also, in that congenital, the cause, which could be from genetic, can also be from maternal infection. Okay, that resulted to that congenital cataract. However, we will talk about the causes. Then when we look at the traumatic type, it's a result of traumas. Then toxic type can also be as a result of exposure to toxic chemicals, especially those who are occupationally exposed, or people like welders who are exposed to excessive flashes of light. All right. Then another category of cataracts, or another way to categorize cataracts, is by identifying the different parts of the lens where the cataract has occurred. Under it, we now have posterior pole cataracts, nuclear cataracts, cortical cataracts, and lamellar cataracts. You will see them on your screen. Another method of categorizing cataracts is also by degree of cataracts, which can be in the form of immature cataracts, matured cataracts, hypermatured cataracts. Okay, so these are the ways which we can categorize cataracts. Now let's look at the causes of cataracts. The first cause of cataracts is congenital causes. Under that congenital causes, we talk about genetic makeup of the child. Genetic makeup of the child, if it is altered, maybe from any cause, such as misplacement of certain proteins, or during the unfolding of the genes in the ribose, okay, or in the endoplasmic reticulum, or during the formation of the messenger RNA, there is an interruption, or during the coding there's a problem. It can lead to autosomal recessive or dominant problem in the gene, and which can lead to cataracts. And this happens mainly during organogenesis, when the organ is being formed in the uterus. Another cause that can lead to congenital cataract is maternal infections. There are infections that the mother will have. It will affect the baby too well. And these diseases have been coined under a term, will I say a term or abbreviation known as TORCHES complex, where the TO stands for toxoplasmosis, the R stands for Rebular syndrome, the C stands for cytomegalovirus, the H stands for herpes, and the S stands for syphilis. Toxoplasmosis is a protozoa-related disease that is being transmitted from cats and dogs. It affects the baby, especially or the fetus. Let's call it the fetus, especially the first trimester. It can actually destroy the baby's brain or the ear if the mother is infected with this disease. And the drug of choice is doxycycline, but doxycycline is contraindicated in pregnancy. Then Rebular, we know measles. Measles-related viruses, all those German measles and all that, they affect the baby, the fetus during the first trimester, and can destroy any part of the brain or even the ear or even the sight. The same way cytomegalovirus and syphilis, they are deadly. That's why most women during the screening should be screened for venereal diseases like this, especially for latent syphilis. It could be dangerous. Then another cause of congenital cataracts can be from maternal drug use, the type of drug the mother used, especially thalidomide and corticosteroids. Okay. Then maternal infection can also lead to that maternal infection. We've said it already. Okay. Then another cause of cataracts is another cause of cataracts includes trauma. Trauma can be in the form of penetrating injuries, such as sharp objects, which damage the lens. It can be in the form of chemicals, hot chemicals or corrosive chemicals affecting the eye during accidents. It can be from burns, excessive burn of the eye. Okay. It can also be from blunt injuries. All right. Then another cause of cataracts is metabolic diseases. Metabolic diseases such as diabetes, such as galactosemia. They can actually lead to cataracts, especially juvenile cataracts. Then another cause of cataract is old age, senescence. Old age is one of the major causes of cataracts. Then another cause is secondary infections. There are some secondary infections that, especially these chronic diseases such as systemic lupus erythematosus disease, SLE, rheumatoid arthritis, because they affect wider tissues of the body. So they can actually as well lead to cataract. Then other factors which are non-specific also include radiations. Radiations can lead to cataracts, exposure to radiation, and drugs. Also, some certain drugs can affect the lens to a greater extent. Complications of cataracts. What are the likely adverse effects of cataract? 1. Closed angle glaucoma. 2. Phacolytic glaucoma. And lastly, loss of vision. Okay. So these are the possible complications of cataract. Treatment of cataracts. This is purely above your scope. It can be in form of medical and also in form of surgical treatments. In the medical treatment, it involves encouraging these patients or this population or community to embrace healthy lifestyles that can reduce the chances of diabetic mellitus and easy retinopathy, hypertension, obesity. Okay, this includes regular blood pressure, regular monitoring of the sugar, eating of fruits and vegetables, consumption of natural sugars and not refined sugars, consumption of enough water, and engaging in exercise. You know, when people engage in exercise, they tend to burn free radicals, and you know free radicals are deadly. Like all those oxygen reactive species, they reduce the body's level of glutathione. Also, supplementing elderly people with glutathione capsules can also improve and reduce the chances of having cataract. You know that free radicals, they attack the cell membrane of cells, and from the explanation so far, that is the cloudiness, that is conversion of that fiber part of the nucleus, attacking it. If there's a pure link that there is possibility of radicals leading to this disease condition. Then, another medical treatment, consumption of vitamin B, C, and E. These vitamins are known as antioxidants. They have the ability to fight free radicals and cancer-related agents in the body. So these are the medical ways of preventing and treating cataracts. Then the surgical aspect of cataracts, treatment of cataracts, includes intracapsular cataract extraction, ICCA, and extracapsular cataract extraction, ECCA. These are above your scope.